Welcome to our new presentation. Our selected topic for today is urinary tract infection. In this video, we have answered the below questions. 1. What is urinary tract infection? 2. What are the types of urinary tract infection? 3. Who gets urinary tract infections? 4. What causes urinary tract infections? 5. What are the signs and symptoms of urinary tract infection? 6. What are the risk factors of urinary tract infection? 7. How to prevent urinary tract infection without medicine at home? 8. What are the treatments of urinary tract infection? Welcome once again to our nursing exercise channel. If this is your first time here, we have a YouTube channel that aims to enrich your knowledge about your health, fitness, medication, nutrition, diet, etc. And if it is your plan to update yourself about these important issues for all of the important tips, advice, discussion and presentation, make sure to subscribe to our channel and click on our notification bell icon. Let's start our presentation. What is urinary tract infection? A urinary tract infection, or UTI, is an infection in any part of your urinary system, which includes your kidneys, bladder, ureters, and urethra. A urinary tract infection is an infection caused by microbes such as bacteria, viruses, and fungi. Different types of urinary tract infection. Doctors divide urinary tract infections mainly into two types, such as lower tract infections. These involve urethra and bladder. 1. Urethritis. Infection of the urethra is called urethritis, urethral infection. 2. Cystitis. Infection of the bladder is called cystitis, bladder infection. Upper tract infections. These involve the ureters and kidneys. 1. Urethritis. Infection of the ureter is called urethritis. 2. Pyelonephritis. The infection of the kidney is called pyelonephritis. Who gets urinary tract infections? Women get urinary tract infections up to 30 times more often than men do. Also, as many as 4 in 10 women who get a urinary tract infection will get at least one more within 6 months. Women get urinary tract infections more often because a woman's urethra, the tube from the bladder to where the urine comes out of the body, is shorter than a man's. This makes it easier for bacteria to get into the bladder. A woman's urethral opening is also closer to both the vagina and the anus, the main source of germs such as Escherichia coli, E. coli, that cause urinary tract infections. What causes urinary tract infections? Urinary tract infections typically occur when microorganisms enter the urinary tract through the urethra and begin to multiply in the bladder. Those microorganisms are listed below. A. Bacteria. It includes the followings. 1. Escherichia coli, E. coli, derived from the gastrointestinal tract, about 75% of infections. 2. Proteus. 3. Pseudomonas species, Streptococci. 4. Staphylococcus epidermidis and Staphylococcus saprophyticus. B. Virus. It includes adenovirus. C. Fungus. It includes Candida albicans. D. Parasites. It includes the followings. 1. Schistosoma hematobium. 2. Wisharia bancrofti. Risk factors of urinary tract infection. It includes the followings. 1. Female anatomy. 2. Sexual intercourse, especially with multiple partners. 3. Diabetes, especially if poorly controlled. 4. Poor personal hygiene. 5. Problems emptying the bladder completely due to enlarged prostate, kidney stones, and certain forms of cancer. 6. Prolonged use of urinary catheters. 7. Use a diaphragm for birth control or use spermicides or tampons. 8. Pregnancy. 9. Menopause. 10. Weakened immune system. 11. A previous urinary tract infection. 12. Recent procedures involving the urinary tract. 13. Immobility for a long period. 14. Heavy use of antibiotics which can disrupt the natural flora of the bowel and urinary tract. 15. Abnormally developed urinary structures from birth. What are the common symptoms of urinary tract infection for women and men? Symptoms of a lower tract urinary tract infection include the followings. 1. Burning with urination. 2. Increased frequency of urination without passing much urine. 3. Increased urgency of urination. 4. Bloody urine. 5. Cloudy urine. 6. Urine that looks like cola or tea. 7. Urine that has a strong odor. 8. Pelvic pain in women. 9. Rectal pain in men. Symptoms of an upper tract urinary tract infection include the followings. 1. Pain and tenderness in the upper back and sides. 2. Chills. 3. Fever. 4. Nausea. 5. Vomiting. UTI symptoms in men. Symptoms of an upper tract urinary infection in men are similar to those in women. Symptoms of a lower tract urinary infection in men sometimes include rectal pain in addition to the common symptoms shared by both men and women. Natural prevention of urinary tract infection. It includes the followings. 1. Drink plenty of liquids, especially water. Drinking water helps dilute your urine and ensures that you'll urinate more frequently, allowing bacteria to be flushed from your urinary tract before an infection can begin. 2. Drink cranberry juice. Although studies are not conclusive that cranberry juice prevents urinary tract infections, it is likely not harmful. 3. Wipe from front to back. Doing so after urinating and after a bowel movement helps prevent bacteria in the anal region from spreading to the vagina and urethra. 4. Empty your bladder soon after intercourse. Also, drink a full glass of water to help flush bacteria. 5. Avoid potentially irritating feminine products. Using deodorant sprays or other feminine products, such as douches and powders, in the genital area can irritate the urethra. 6. Change your birth control method. Diaphragms, or lubricated or spermicide-treated condoms can all contribute to bacterial growth. Treatment of urinary tract infection. Treatment of urinary tract infections depends on the cause. Your doctor will be able to determine which organism is causing the infection from the test results used to confirm the diagnosis. In most cases, the cause is bacteria. Urinary tract infections caused by bacteria are treated with antibiotics. Uncomplicated urinary tract infection. For an uncomplicated infection, you'll take antibiotics for 2 to 3 days. Some people will need to take these medicines for up to 7 to 10 days. Complicated urinary tract infection. For a complicated infection, you might need to take antibiotics for 14 days or more. Frequent infections. If you have frequent urinary tract infections, your doctor may make certain treatment recommendations, such as 1. Low-dose antibiotics. Initially for 6 months but sometimes longer. 2. A single dose of antibiotic after sexual intercourse if your infections are related to sexual activity. 3. Vaginal estrogen therapy if you're postmenopausal. Severe infection. For a severe urinary tract infection, you may need treatment with intravenous antibiotics in a hospital.